The Aero EZ-IO Intraosseous Access Tray Plus Single-Use Power Driver is available in 3 configurations. The first configuration is recommended for patients weighing between 3 to 39 kilos and includes a 15mm needle set with a pink hub. The second configuration includes a 25mm needle set with a blue hub, which is recommended for patients weighing 3 kilos or more. And the third configuration includes a 45mm needle set with a yellow hub, recommended for patients weighing 40 kilos or more. Clinical judgment should be used to determine appropriate needle set selection based on patient weight, anatomy, and tissue depth overlying the insertion site. Tissue depth over the insertion site should always be assessed when determining the most appropriate needle set length prior to insertion. For the purposes of this video, we have chosen a procedure tray with a 45mm needle set for an IO insertion in a patient weighing greater than 40 kilograms. In addition to an EZ-IO needle set, this sterile single-use intraosseous access procedure tray contains all the components you need to gain intraosseous vascular access, including an EZ-IO single-use power driver, so you don't have to worry about whether it's charged or whether you can use it in sterile environments. ChloraPrep to clean the insertion site, an easy stabilizer dressing to secure the insertion site, an Easy Connect extension set, a pre-filled saline syringe for flushing, an Aero Sharps Away 2 locking disposal cup to secure the stylet, and a pink patient wristband to document date and time of insertion. To begin procedure, peel open the lid stock. Note that there is a quick reference guide on the back of the lid stock to help guide you through this procedure. Refer to the instructions for use for complete instructions. After selecting the insertion site and landmarking, clean the insertion site per institutional protocol or policy. Then prepare your supplies by priming the Easy Connect extension set with approximately 1 ml of normal saline. The clamp on the extension set will come out of the package unlocked. Attach the EZ-IO needle set to the EZ-IO single-use power driver and remove the needle safety cap. Then remove the orange pull tab labeled Pull Out to Use from the EZ-IO single-use power driver. Pulling out this orange tab will activate the driver batteries. Push the EZ-IO needle set through the skin until the tip touches bone. At least one black line on the needle set cannula must be visible outside the skin before engaging the driver. Squeeze the trigger of the EZ-IO single-use power driver and apply gentle, steady pressure. Advance the EZ-IO needle set into the insertion site and release the trigger when a sudden pop or give is felt, indicating entry into the medullary space. Stabilize the EZ-IO needle set hub and disconnect the EZ-IO single-use driver. Continue to hold the hub and turn left to unscrew and remove the stylet. Using a one-handed technique, secure the stylet in the Aero Sharps Away 2 locking disposal cup for sharps containment. During use, the Sharps Away 2 locking disposal cup should remain in the tray on a flat surface. If lab samples are needed, attach a syringe directly to the EZ-IO cannula hub. Stabilize the hub with your non-dominant hand. The first 2 ml should be discarded or used for point-of-care testing. Then place the Easy Stabilizer dressing over the cannula hub. For patients responsive to pain, consider 2% preservative-free and epinephrine-free lidocaine, intravenous lidocaine. Follow your institutional protocols and policy. Attach a primed Easy Connect extension set to the EZ-IO cannula hub. Firmly secure it to the cannula hub by twisting clockwise, and ensure the clamp is open. Adhere the Easy Stabilizer dressing by pulling the tabs to expose the adhesive and adhere to the skin. Secure the affected limb to minimize movement and risk of dislodgement. Consider slight aspirate for visual confirmation of bone marrow. Flush the EasyIO cannula with 5 to 10 mL of normal saline for an adult patient. For an infant or small child, flush with 2 to 5 mL of saline. Document the date and time of insertion and apply the wristband. Monitor insertion site frequently for signs of infiltration or extravasation. The Sharps Away 2 locking disposal cup should be disposed of in an approved Sharps container. Break the battery compartment of the EasyIO single-use driver to remove the alkaline batteries and dispose per institutional policy.